Emma Vic Mahuna's powerful interview on RTE's Morning Ireland set the agenda for today's meeting of the Public Accounts Committee, in which Tony O'Brien faced further questions on his role in the crisis.
Mrs Vic Mahuna on the radio this morning has not time to wait. She said she's too angry to worry about dying. And we're in here kicking a football around about, let's have an investigation, let's see what happened. Where is the accountability?
Why don't we both wait? Why don't we both wait until the outcome of the expert review, and then you can reflect and I can reflect. At the moment, you are causing hysteria.
Mr O'Brien also told the committee that while he learned about the case of Vicky Phelan on RTE News, he was told in a briefing note in 2016 that a communications process was about to begin to notify patients with cancer about an audit of their smear tests.
What were you made aware of in relation to the number of people affected? Please, did you ask questions to elicit more? Did you sit down or escalate the process?
I was advised that the audit had not thrown up any issues of concern. I was advised that the audit would be communicated to the individuals who were the subject of that audit. I was provided with quite some detail as to how it would be done. I was never subsequently told that any issues had arisen or anything had happened to disrupt that plan.
This afternoon, 3 versions of a 2016 memo, one from March and 2 in July, to Mr O'Brien, were released to the Public Accounts Committee. The memos state that most cancers were detected, but not all were prevented. From February 2016, Cervical Check began telling treating doctors of the audit outcomes. But some of the laboratories doing the smear testing expressed concern in legal letters about Cervical Check informing doctors. The memo said there was a risk of patients reacting, contacting the media, if they feel that screening did not diagnose my cancer. In 2016, Cervical Check said it had prepared communications material for the media and the public on the audits and the results.
For more, our health correspondent Fergal Bowers is with us in studio, and our political correspondent Martina Fitzgerald is at Leinster House. Good evening to you both. Fergal, to you first. What is the Department of Health saying tonight about these memos? And for you, what stands out as some of the more striking elements in their content?
Well, the department said tonight Cervical Check shared a number of documents with it in relation to the smear test audit, including these HSE memos. But the department says the documents weren't shared outside of the Chief Medical Officer and the HSE. It also said it's currently examining the records, and all documents will be made available to the preliminary inquiry headed by Dr Gabriel Scally. Those 2016 memos, seen by Tony O'Brien, they are very revealing. They say Cervical Check new cancer cases had been missed. It said that over 1,200 cases of cervical cancer had been notified to the service, and it was reviewing 315. It was about to start telling the treating doctors, but was warning of the risk of patients contacting the media. So a media strategy to counter potential negative publicity from patients was put in place. And one of the memos says, pause all letters to doctors, await legal advice, decide on the order of volume of dispatch of letters to mitigate potential risks. So that's code for drip, 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 slow release of letters to keep things calm. So it all seemed to be about containment, not the women and the families affected being the top priority.